Welcome back, and thank you once again for joining us on the Healthy Parenting Podcast. I'd like to welcome today's guests, Claudia and Alberto of the Mothers in Recovery program. Hi, Claudia.
Welcome,
Hi, Roberto.
welcome.
Hi, guys.
Hi, guys.
So tell us a little bit about your background and how it came to be where you're involved with the recovery of drug and alcohol addictions and mothers and newborns.
I'm a licensed clinical supervisor and also a licensed marriage and family therapist, and I've been with Memorial for 13 years and counting.
Oh, great.
And so I have experience in mental health and working with substance abuse issues in the community for a long period of time.
Fantastic.
Excellent, excellent.
And I'm probably in the system a little less time, going on about 7 years. I am a psychopharmacologist. I'm also a clinical toxicologist. And a lot of my training had to do with substance use and really the therapies that are involved and how to treat these individuals. Specifically now we're dealing with mothers and the effects that may happen on the newborn, but that's basically the extent of the background.
Interesting, interesting. Well, during our coffee chat, we actually had a mini discussion about the growing opioid addiction with pregnant women. And a lot of news stories like that. It's becoming like an epidemic. Are you seeing more Are you seeing more mothers needing treatment or prescription drugs, or is it legal drugs?
So there's definitely a growth in the amount of mothers needing assistance. I would say, especially in South Florida and various different pockets of the United States, we're also seeing similar trends. We did see a significant increase in the use of opioids in the early 2000s, and this was initially attributed to prescription habits. So this opioid prescription habits led to an increase in patients needing these pain meds and so forth. And what we've seen, especially locally, is there has been a reduction in access to a lot of these pain meds, which is a good thing. But it's also led some of these patients to access other means, including heroin. So in South Florida particularly, we've seen a triple, almost maybe quadruple, increase in the rates of heroin use in patients that were previously on opioids.
I did not know that.
I
Wow.
did not know that either.
So Jason brought up an interesting question prior to both of you joining us. Are these mothers becoming addicted because they were prescribed medications prior to their pregnancy and then it goes on into pregnancy, or are they receiving prescription medications while they're pregnant?
So I would say the majority of these moms were prior to them becoming pregnant. Very few times is it a patient that initiated this habit just because they picked up heroin, let's say. Most of the time is they were prescribed something. There are cases even of some patients who were initially receiving treatment in an ED, for example, or in hospital, and they required an opioid to help treat a pain issue, and then they were continuing on this opioid, and then for a valid medical reason, but then it became an addiction, and that's what we're dealing with today.
Yeah, I think to Alberto's point, one of the things that they found when they looked at analysis of patients who are pregnant women on Medicaid, and they looked at some of the prescriptions that they were filling on a national level, and they were being prescribed these opioids at high rates. So they might have started on these medications before they were pregnant, and I think that's usually the case, but they were continued by their doctors while they were pregnant on these medications.
While they were pregnant, they were
Mhm.
still able to get prescriptions.
Is that normal? I mean, if I can use that term.
So it's a good question, and I would say nothing is black and white. There's always a gray. So there are some instances where moms do have significant pain, and you need to treat the pain. So it makes sense. I would say normal is many of them do not, and there are ways that we can reduce the demands of the opioid or altogether eliminate it. So I would say for a long time, the understanding has been if a mother is using an opioid and then they do become pregnant and so forth, the recommendation is to switch them to methadone. And methadone is also an opioid, and it's actually been around for over 40 years. And methadone is considered the gold standard up until what we initiated, and the patient would be on methadone in place of this opioid for the duration of the pregnancy.
So, and just to add to that, I think that opioid prescribing practices are changing, and this has only been in the last couple of years. So last year, the Surgeon General, Vivek Murthy, came out with a report on the opioid addiction, and they were prescribing practices that they were recommending because there's been liberal prescribing of opioids. And then now that we're cutting back, like Alberto mentioned, people that now can't get that prescription. So I think doctors, maybe to a pregnant woman now, will be a lot less likely to prescribe that medication. But if she's already addicted, she may be going to the street and getting medications there. So now you have someone who's maybe using heroin off the street, and the way that these women have been treated up to now is to put them on methadone maintenance for long periods of time, and we can maintenance throughout their pregnancy, and we can talk about what some of the consequences or unintended consequences of that has been.
It actually helps clarify that, because it really was something I was really concerned about when I read that. I was like, okay, I mean, I know myself and the audience would love to hear a roundtable discussion between my co-host and our guests about the impact that drug addiction has on newborn babies.
And I think that's probably one of the greatest issues with before we started our program. The concern in our community, and I think this is nationally, is that we are seeing these trends of an increase in neonatal abstinence syndrome. So the babies that we have are being born with higher rates of neonatal abstinence syndrome.
What is neonatal abstinence syndrome? Can you define that for us?
Sure. So neonatal abstinence syndrome is essentially a set of symptoms a baby exhibits when they're born, and it's basically what the word is saying. They're abstaining. They are abstaining from some compound, and when we're describing these in opioid specifically, we're discussing opioid withdrawal. But it could be anything really. So it's not just opiates and opioids. It could be benzodiazepines, which is another controlled substance. It could be cocaine. So nevertheless, essentially the baby starts exhibiting a variety of withdrawal signs and symptoms when they're born, and these signs and symptoms can be very severe. And anybody that's worked with the neonatal can tell you that when a baby is diagnosed with NAS, neonatal abstinence syndrome, it's very difficult to watch how the baby goes through this. It could be a very high-pitched crying, a baby that won't be consolable. So it's very difficult to see. And then we can treat the baby, and the treatment of neonatal abstinence syndrome is actually to initiate an opioid to prevent the withdrawals the baby is going through. And that's the problem. So the neonatal abstinence syndrome that may ensue needs to be treated with an opioid, and we're oftentimes treating this baby for an average of 7, sometimes 30 days with an opioid in a NICU setting to prevent the severe withdrawals that the baby is suffering from.
I know you mentioned inconsolable and high-pitched crying, but I mean, what other symptoms? Because I'm thinking of a newborn is crying, it's sleeping, it's crying. So, what other symptoms would be a red
Are
flag?
you saying that that's normal?
Well, no. I'm saying, so crying, yeah, but
That sounds like a normal baby.
exactly. So I'm saying, I mean, I
So that
don't
inconsolable.
know if I'd be able to recognize a child going through those withdrawal symptoms with just inconsolable crying.
So essentially, an opioid does a variety of things in the human body. One of the things an opioid does in the human body is that it reduces our respiratory rate. It reduces the ability for the body to release something called norepinephrine. So that is basically the ability for your heart to beat faster. It changes your GI motility. So an opioid can cause constipation. So the moment you remove said opioid from a body, your body starts experiencing a withdrawal, meaning it doesn't have this opioid to cause those effects. So the opposite happens. So in other words, the high-pitched crying, inconsolable, diarrhea, the heart's racing fast.
Failure to thrive,
right.
So the baby's not responding to it. Even the nurses or the caregiver are trying to help the baby, console the baby, and that inconsolable is the baby can't stop crying. It's just their body's like writhing in pain. So maybe a lot of people may not know somebody or have seen somebody going through withdrawal symptoms from an opioid, but maybe you've seen it in the movies, which is obviously in the movies. But imagine a newborn baby going through that pain.
Like that.
Yeah.
Wow.
How devastating it is. And I can't imagine any mother would want to witness that in their child. Do you find that you have more likely for success for a pregnant woman getting her off of drugs during that time, just thinking about the baby?
So
or is that just like...
So we'll talk about some
different
of the statistics that we see currently. So the prior to what we initiated, the current standard of practice, like Claudia mentioned, was initiating methadone, and methadone is an opioid itself. So the statistics tell us that for the babies that are initiated on, the moms that are initiated on methadone, close to 100% of those will deliver a baby that is diagnosed with neonatal abstinence syndrome.
Wow.
And then those babies now, the length of stay has increased. The average length of time is they would need about 30 days in a NICU to treat the neonatal abstinence syndrome that the baby has now developed.
So that's a standard treatment now for a mom being addicted to opioids in pregnancy. The standard treatment is causing these high rates of neonatal abstinence syndrome in these babies once they're born. So they're trying to get treatment, but the treatment is having these consequences on the baby.
Okay, so we have the mom's decided, she's ready to get clean. She's really hurt that her baby's suffering. How are moms treated then?
So our program is unique. We modeled it after a program based off of something called the Mother Study, and essentially we utilize a different opioid, something called buprenorphine. It makes it a very unique compound because it's different than methadone. It has less effects on the opioid receptor, so there's less risk of neonatal abstinence syndrome. And actually, our program, we are now 2 years since we started our program, and we've treated over 70 moms. And the goal of our program is actually to completely detoxify the mom during the second trimester.
Oh, that's wonderful.
And we've had very high success rates, and we've had approximately 92% of our moms who've given birth give birth to babies that are drug-free.
And is the success from this new compound that you're giving
The
them?
compound and the method in which we use, which is
It's really about comprehensive care that's integrated. So when you talked about, is a woman who's pregnant more likely
Yeah,
to get
she
clean?
motivated.
Is she more motivated?
Yeah.
And we try to really, from a psychological and emotional perspective, really tap into that motivation and have them connect with the idea that they're going to have a baby soon and they want that baby to be healthy. So often what happens when a mom is using, and she knows that she's hurting her baby in a way, that's that you can't disconnect from that, but they actually psychologically disconnect from the baby. They disconnect from the pregnancy. There's a
right?
yeah. I mean, imagine hurting a child and it's your child and you know that you're hurting them. You almost don't want to be aware. You'd like to be in denial that that's going on, and that's what happens. So our work is really building that person up and getting them ready in the sphere of recovery, but preparing them for motherhood.
So before they get to the point where they're detaching, what advice would you give a pregnant woman who frequently uses opiates or over-the-counter or prescription drugs before they get to that point? What advice or
Like, how would they know they're even addicted to seek help through the program?
question.
I mean, I think the answer to that would be multifactorial. Obviously, every patient's unique. Every patient we've encountered has a different story. I would say that for the most part, most of these moms very well know that they are using a substance that they probably shouldn't be using and that is causing harm to the baby.
Will they admit that to a healthcare worker?
Yes,
Like, if you're
yes.
screening them, are they forthcoming? Will they say?
Screening is a major part of what we want to look at. Is overall we have this problem. So going back to the opioid prescribing practices, we know that we were prescribing opiates way more than we needed to, and that these pregnant women were getting this medication and that they were being continued on it. Babies, we had high rates from 2001 to the present of babies born with neonatal abstinence syndrome. So we started to look at, okay, let's treat neonatal abstinence syndrome. Like Alberto said, what are the best treatments? How do we optimize it? But without backtracking and saying, let's treat the mom while she's pregnant. Let's screen her when she comes in for that prenatal visit. And let's talk to her about getting care. And there is help out there. There's, we know, I think as a nation, we're becoming aware of this impact on the baby. So we want to get treatment, talk to somebody, be open about it. You might know because when you stop taking it, you start to feel symptoms of withdrawal. But for a lot of people, if a doctor's prescribing something, they don't think that I shouldn't be addicted. The doctor's prescribing it to me, right?
And I would add to that. I would say that many times not only they may be aware of it, but I think that the greatest challenge is having access to a program like ours, having access to a program that can actually help you. A lot of these moms actually go to the emergency department and say, I want help. And many times the answer has been, we don't have the help you may be looking for. which is unfortunate. So we hope that programs like ours can be established in different parts of the country.
How can we refer mothers to your program? Is it through a physician? Is it through the community? Like if you know, or in the community, identify someone that you know is addicted, can they send them to your program?
They could definitely send them to us. We have information on the Memorial website. You can also call our number. It's 954-276-3429. We have a licensed clinical social worker that will reach out to the moms, work with a provider if there's a physician that's referring a patient to help link them with care. And as soon as they need it and they want it and they're ready to come in, we're ready to receive them.
And we have received emails and there have been other people reaching out to us from other parts of the country. So if that is the case as well, I'm sure there may be some potential for development in other parts of the country as well.
That's wonderful. Thank you for the amazing
thank
work
you
you
so
guys are
much.
doing. This is
It was a pleasure.
It is our pleasure, believe us. It's very rewarding to see a mom give birth to a baby that's healthy, and that look of love that she's showing that child it's priceless.
And you guys are doing important work. We thank you so much for your time.
Thank you for having us.
Thank you.
Thank you for joining us on Healthy Parenting. Please subscribe to this podcast on iTunes, tell others about it, and visit Joe DiMaggio's Facebook page.
important topic, very important topic.
Very important.